Phlebotomy Certification Exam Review. Question 1. What is the most common site for venipuncture? Radial artery, brachial artery, median cubital vein, femoral vein. The median cubital vein is large, superficial, and less surrounded by nerves, making it the preferred site for routine venipuncture. Question 2. Which additive is found in a lavender top blood collection tube? Sodium citrate, EDTA, heparin, fluoride. EDTA is an anticoagulant that preserves cell morphology, making it ideal for hematology tests like CBCs. Question 3. Why is the correct order of draw important during venipuncture? To speed up the collection process. To ensure patient comfort. To use fewer supplies. To avoid cross-contamination between different tube additives. Drawing tubes in the wrong order can cause additive carryover, leading to inaccurate test results and diagnostic errors. Question 4. Which antiseptic is preferred for cleaning the skin before collecting blood cultures? Isopropyl alcohol alone, hydrogen peroxide, chlorhexidine, soap and water. Chlorhexidine has residual antimicrobial activity and a broader spectrum than alcohol, reducing contamination risk in blood cultures. Question 5. When should a phlebotomist remove the tourniquet during a blood draw? Immediately after needle insertion. As soon as blood flow begins. After 2 tubes are filled. After all tubes are collected. Removing the tourniquet once blood flows prevents hemoconcentration and hemolysis, ensuring accurate test results. Question 6. What does the term postprandial mean? After meals. Before meals. Before bedtime. After exercise. Postprandial refers to the period after eating, commonly used for glucose testing to assess diabetic control. Question 7. A phlebotomist has attempted venipuncture twice on a patient without success. What should they do next? Immediately try a third stick in the same location. Ask another phlebotomist for assistance or consider alternative sites. Reapply the tourniquet more tightly. Ask the patient to drink water immediately. After 2 unsuccessful attempts, clinical policies recommend seeking assistance to prevent patient discomfort and complications. Question 8. Which personal protective equipment, PPE, is always required when performing venipuncture on a patient with HIV? Gown. Gown and gloves. Gloves only. Face shield. Gloves are always required for venipuncture regardless of diagnosis to protect against blood-borne pathogen exposure. Question 9. Which blood specimen must be transported on ice? Bilirubin, ammonia, potassium, hemoglobin A1c. Ammonia and lactic acid require ice transport to prevent concentration changes that would alter test results. Question 10. Which specimen is light sensitive and should be wrapped in foil? CBC, glucose, PTT, bilirubin. Bilirubin breaks down when exposed to light, so it must be protected during transport to ensure accurate measurement. Question 11. What is the first thing a phlebotomist should do when approaching a patient? Put on gloves. Wash hands. Identify the patient. Assemble supplies. Patient identification is the top priority to ensure you are drawing blood from the correct individual before any other actions. Question 12. What is the correct needle insertion angle for venipuncture? 5 to 10 degrees. 15 to 30 degrees. 45 to 60 degrees. 60 to 90 degrees. A 15 to 30 degree angle allows smooth entry into the vein without penetrating too deeply or passing through the vessel. Question 13. Why are two sets of blood cultures collected from two different venipuncture sites? To reduce testing costs. To make the patient more comfortable. To ensure faster lab processing. To confirm infection and rule out contamination. Two sets from different sites help distinguish true bloodstream infection from skin contamination during collection. Question 14. When performing a heel stick on an infant, where is the safest site? Center of the heel. Arch of the foot. Lateral or medial heel. Big toe. The outer sides of the heel reduce the risk of hitting bone, nerves, or causing injury to the infant. Question 15. What is the purpose of gently inverting a blood collection tube after drawing? To increase oxygen in the sample. To mix the blood with the additive properly. To reduce hemolysis. To decrease glucose levels. Gentle inversion ensures proper mixing of blood with additives, preventing clotting and preserving sample integrity. Question 16. Which tube should be drawn first when using a butterfly needle with tubing? Red tube. Lavender tube. Green tube. Discard tube. A discard tube removes air from the butterfly tubing, ensuring accurate blood-to-additive ratios in subsequent tubes. Question 17. What does the term anemia mean? Excess white blood cells. Low hemoglobin or red blood cells. Low platelets. High cholesterol. Anemia is a deficiency in red blood cells or hemoglobin, which reduces oxygen transport throughout the body. Question 18. A patient has an IV infusing in the right arm and an AV fistula in the left arm. You need to draw a PT and PTT. What should you do? Draw above the IV site in the right arm. Draw from the left arm. Draw from the right arm far below the IV site. Consult the nurse before drawing from the arm with the IV. Consulting the nurse allows for pausing the IV or finding an alternative site, as drawing above an infusion can falsely elevate coagulation test results. Question 19. What is the maximum recommended time a tourniquet should remain on a patient's arm? 30 seconds. 60 seconds. 2 minutes. 5 minutes. Tourniquets should not remain on longer than 60 seconds to prevent hemoconcentration, nerve damage, and patient discomfort. Question 20. What is the first action a phlebotomist should take after a needle stick injury? Finish the blood draw. Wash the area with soap and water, then report to a supervisor. Apply a bandage and continue working. Ignore it if no blood is visible. Immediate washing and reporting are critical for post-exposure prophylaxis and proper documentation according to OSHA standards.